RFK Jr. announced this new federal initiative focused on reducing what he calls overprescribing of psychiatric meds, especially SSRIs. So SSRIs are antidepressants that you've all heard of. Prozac, Zoloft, Lexapro, those are like the main ones. Those are the very popular ones that a lot of people end up taking. And basically the whole initiative he's putting together is training doctors on deprescribing, Medicare reimbursement for helping patients taper off medications, and then more emphasis on therapy, exercise, nutrition, and non-drug treatments. So I just to put some context on this whole story, because I think it's really important, around 1 in 6 American adults right now is reportedly taking antidepressants. That's a huge number.
Yeah.
And millions say that SSRIs have helped save lives, stabilized anxiety, treated severe depression, made daily life functioning totally possible. But others say that they were prescribed too casually. And some people have complained that nobody explained the withdrawal risks, or getting off SSRIs can be brutal. Like some people go into it not knowing that it is so hard to get off of them.
Sure.
So the mental health experts have been pushing back. Organizations like the American Psychiatric Association warned against stigmatizing medication. And critics are arguing that depression is already undertreated. Some patients could stop medication unsafely because of all of this and this discussion around it. And also, critics are arguing that framing SSRIs as harmful could scare vulnerable people from starting that may need this kind of treatment.
Sure.
So obviously, it's a very nuanced conversation. Many of the medical experts are agreeing that tapering off, if you are going to do that, should be happening very slowly, if that's something you even want to do. Under medical supervision, and that, it's really based on person to person. So I thought it was really interesting. I mean, what do you think about this?
I mean, so I've been reading about this for the past week because I saw his letter that went out, basically encouraging people, doctors, to prescribe less in general, and like sort of outlining what Teague just talked about.
Yeah.
But I think for me, I guess my concern is that I don't foresee mental health just getting better by people taking fewer drugs about it. I think what we've run into in this country is that there is not even necessarily as much of a stigma as there used to be, but I'm not sure that people have access to much mental health help beyond just taking a drug.
Right.
And so for me, I'm just worried that like people won't be able to overcome that just like through grit and white knuckling it through life.
Right.
And I think that's what I'm a little bit worried about. And like, to be honest, like I take an SNRI, which would likely be, it's not as like buzzy as an SSRI, but it would likely also be impacted in this shift as well, the one that I take. And so yeah, I mean, like, of course, I think most people would prefer not to have to take an antidepressant in general. But I think that doing it in a way that makes sense for them is the only thing you can do.
Yeah. And honestly, like anybody who I know who's ever been on antidepressants, it's a big discussion. It's not like a knee-jerk reaction and people instantly get on it. Like I feel like the idea of like overprescribing and it being too easy, I'm like, I feel like people really weigh their pros and cons with getting on those drugs. So it was shocking to me that he was, suggesting that people are taking it willy-nilly.
Willy-nilly, yeah. I feel like anytime anyone I've ever met has like had many conversations, they've tried to do it naturally first. You know what I mean? I don't know. That has not been my experience.
Yeah.
I don't want to say it's not happening because I have no idea, but I mean, 1 in 6 Americans is a lot of people, to be fair. So I don't know. Are really 1 in 6 of us depressed? Probably. But
and also it's like, we need these options. I mean, modern day life is hard. And I know we have so many luxuries, and it's even, I feel like very privileged to even say that, but like, it's, if that is something you need in your routine, whether it's whatever you're going through, like, I think, knowing that there is an option if things get to a place that you don't feel like you can control anymore is nice to have that, instead of like feeling like, oh, I shouldn't get started because I shouldn't do that. I don't know.
Right. Well, and I will say this, RFK Jr. has also cited a bunch of kind of factually incorrect things in his argument against. It's like there are pros and cons that are scientifically backed. And then there are cons that he has sort of invented. Like there is no scientific evidence linking school shootings to the proliferation of SSRIs.
Did he say that?
He said that a few times.
Oh my gosh.
And so like take everything with a grain of salt, I think, and do your own research and make sure you're using science-backed studies, peer-reviewed studies when looking into what kind of drugs you want to take. So
yeah, that's really interesting.
Yeah.